your role. It's great to see folks here. Hey, Alyssa from Bennington. It's nice to see folks from different parts of the state. Feel free to say hello, introduce yourself in the chat. Excited to have folks here. Hey, Kate from Cannon. Nice to see you here. Deborah from Twinfield Union School. We have parents and educators here today. Deborah helped organize this event. Christy, educator in South Burlington, also part of the organizing crew. Thanks so much for folks helping put this together last minute. Dr. Travia Charles on the school district. Really great to see people here from all kind of aspects of our educational system. Welcome everyone. For folks that are just coming in, feel free to introduce yourself in the chat, your name, pronoun, where you are, and any role you have with the schools. And we'll get things kicked off in about a minute here. So I'm going to start things off by just giving a little background about how this event came together, and then we'll go over the agenda and objectives. So last Monday, the Education Organizing Committee of the Education Justice Coalition, for which I work with, got together to have a meeting about an entirely kind of different topic. And then we realized that a lot of folks were having a lot of questions and concerns, particularly regarding folks in our community with disabilities, people that are medically vulnerable, with the ending of the mask mandate. And I think a lot of folks realized we didn't feel like we had the tools like on our own individually to know what to do, what to say, how we could be supportive. And so that's why we created this space to kind of have a collective conversation about not only the end of the mask mandate, but when we started talking about this kind of this broader conversation about as COVID turns from being a pandemic to an endemic, we want to like name and recognize that it is still having impacts, particularly on people in our communities that are medically vulnerable or have disabilities. And we want to recognize those impacts go beyond just getting rid of masks. And so while this conversation starts with masks, we hope to also kind of think about other issues of education equity and how COVID has impacted those. So to go over our objectives for today, our goals are together become familiar with the health equity framework, discuss the end of the mask guidance in schools from a disability justice and health equity lens, explore how COVID has impacted education equity, and equipped administrators and teachers to have inclusive equity-centered conversations about masks. And just to reintroduce myself for those of you that may not know me, my name's Alyssa Chen. I use she, her pronouns. I'm the coordinator of the Education Justice Coalition and a former teacher and coordinator in alternative high school programs. Our agenda for today, we're right here in the welcome and opener. Then we'll move into a panel discussion that will actually start with a brief presentation on a health equity lens from Dr. Ann Sosin. Then we have a couple volunteers who will present a resource, really thinking about, given that this change is occurring, how can we frame conversations in our schools to really continue to center health equity and disability justice? Then we'll break out into small groups to have some time to kind of like digest and talk about and think about bringing home the lessons learned today. And then we'll have a brief closing. Oops. Just a quick tech note to help us out for later. We are going to have small groups, and we will have a student and BIPOC affinity space for those that would like to join those. So if you think you'd like to join those, just put a S or a B at the start of your name. Like you just put, if I was going to join a BIPOC group, I'd put B-Alyssa Chen. You could leave your name and pronouns the same. And there's a little photo here in case you need to know how to do that. You hit your little 3 dots, and then you can rename yourself. And that will help us for breakout groups later today. And I'm going to end this PowerPoint, and I'm going to pass it on to Dr. Ann Sosin, who will kind of kick off our panel with a little bit of framing around health equity and what that means to us in this moment. And thank you so much, Ann, for being here with us today.
Thanks so much. Hello, everyone. It's really nice to see so many familiar names and faces today. I just wanted to get us started today by talking about masks and health equity. And I want to start by just bringing this into a school context. When we're thinking about the conversation around masks in schools, we often, a couple of things come to mind. Often the conversation centers around children. And right now in the state of Vermont, we're thinking about vaccinated children. The first is my own 9-year-old daughter who's vaccinated. And in the state of Vermont, we're often looking at our really high vaccination coverage, including in children 5 to 11. And in the state of Vermont, we're also often thinking about our rural context, and many think that our rural context alone protects us from COVID. And I want to complicate all of those narratives a little as I bring the conversation back to thinking about masking right now. So just to lay some groundwork for our conversation today, let's get started with a couple of definitions of health equity. When we're thinking about health equity, we're thinking about more than the prevalence of disease or biomedical treatments to disease. There are a couple of definitions that we see. One comes from the Robert Wood Johnson Foundation, and the Robert Wood Johnson Foundation is that health equity means that everyone has a fair and just opportunity to be as healthy as possible. And their definition encompasses other barriers to health, including poverty, discrimination, powerless, and lack of access to good jobs with fair pay. We might also put schools and education in this definition as we begin this conversation. Whitehead says this about health equity. In the public health community, the phrase social inequalities in health carries the same connotation of health differences that are unfair and unjust. So it's not simply differences, but differences that are unfair and unjust. And those differences are created not only in the health sector, but in other areas that shape health. And by some definitions, more than 80% of our health is shaped outside of the health sector. Some of us we talk about the social determinants of health, those other things that shape our health. What does this mean when we're thinking about COVID-19, and how do we bring a health equity lens to bear on COVID-19? By now, 2 years into the pandemic, we're all familiar with this idea of medical vulnerability. And when we think about medical vulnerability, what we're talking about is our risk for severe COVID-19. And typically they're biological factors that shape our risk. We're thinking about age. COVID-19 is really sensitive to age. We're also thinking about underlying health conditions. And post-vaccination, we're thinking about people who are immunocompromised, who can't benefit fully from the protection of vaccines. And we're also thinking about those who are not yet vaccinated, children under 5 or others who are not vaccinated. But when we think about health equity, we also need to be thinking about risk of infection or exposure, and then our risk of transmitting onward to other people. And the things that shape social vulnerability or those risks of exposure and transmission lie outside of the health sector or biological factors. Those things are driven by social factors. They're determined by the places we live, the places we work, the places we learn, the ways that we move around. And often it's those this disproportionate risk of exposure and transmission that drives the COVID inequities that we see. We may be at high risk of severe illness, but not really at very high risk of contracting COVID, or not at high risk of passing it along to others. And our COVID disparities often reflect disproportionate risks at individual and population level. If we look at our long-term care facilities, we see this convergence of both medical and social vulnerability. And that's one of the reasons we saw early in the pandemic a high concentration of mortality in those settings. Bringing that back to our rural regions, many of us, when we think about Vermont, we often think about distance between us. What we don't see is that all of us are part of institutions and social networks that are closely linked, and our schools are closely linked to other institutions. Although we may be low risk individuals, we're part of institutions and can and live in households that may include high risk people. We may work in places that include high risk people, and it's those places and the environments we inhabit that often drive risk at the community level. In addition, when we think about health equity, we also think about public health measures that we put in place to mitigate disparities. And in our own state, we see that the protections that we have in place, both from vaccines and other mitigation strategies, mirror, or the coverage of those protections mirror other health and social disparities in our state. Even though our top line vaccination indicators are among the highest in the country, we see disparities when we look down to county and town level that track with other disparities in our state and shape risk as we look ahead. So some communities have very high rates of vaccination, high compliance with public health measures, and will continue even in the post-masking era to have higher levels of masking. But that doesn't mean that we don't have high risk individuals and communities with less protections in place. Now, I want to talk a little bit about why personal responsibility isn't public health, and it's just not enough still right now to protect those that are most at risk and to mitigate the inequities that we see. There's been a lot of discussion in our state and other places about personal responsibility. We've heard that individuals have the tools, and I want to disrupt our thinking on this a little bit. When we shift our responsibility from institutions or policies to individuals, what we're doing is we're concentrating the risk and burden on our most vulnerable in our communities. As I said before, individuals who are most at risk, the immunocompromised and children under 5, can't yet benefit fully from vaccination and rely on community for protection. They rely on the things that other people do around them. And unfortunately, the places we live, work, and learn are not choices for the most part. We don't choose whether or not we go to school, and oftentimes we don't choose what community we live in. That's shaped by other social factors. And so as we make this shift, what we're seeing is that the absolute risk in the places where we need to be doesn't change, but there are now higher thresholds for action. And the onus is on individuals versus institutions for taking those actions. This means that the environments that higher risk people are inhabiting are less safe. And there's a myth that many just have the tools to protect themselves and it's time to move on. But if we look a little bit closer, we see that many still don't have the tools to protect themselves. We still don't have enough therapy for people who are treatment, for people who are at high risk. Availability of tests and masks is not sufficient in many communities. And so we're really not in the place where we can alone say that individuals are ready. I want to now just talk very briefly about why masking is a tool for advancing health equity, given everything I've just said. We know that structural factors drive disparities and inequities, but it's really difficult in the short term to act on these individual or structural risk factors. We can't change someone's risk to COVID. We can't mitigate that we can't easily change their crowded housing or work conditions, but we can mitigate these settings and reduce the risk in them. And masking makes the essential places where we live, learn, work, and learn safer and more accessible. It makes it less likely that a child will contract COVID and take it into their crowded households that might have a high-risk parent or grandparent or someone else living there. We know that no study is perfect. However, we now at this point have many studies in support of masks and mask policies, showing that masks reduce cases in school. They also reduce quarantines or lost educational time. And we also know that collective masking is most effective. It creates protections around everyone, and it's much more effective than one-way masking, both for scientific and social reasons. We also know that high-quality masks offer significantly more protection than cloth masks. Okay, so just a couple of things about what you can do. I know that we're at a specific moment. Policies are changing really quickly, and we can talk about health equity, but but we're confronting a situation where the onus is really being placed on individuals to protect themselves. So I want to begin by saying that the best, our policies provide our best protection. Mandates give everyone the same protections, regardless of their health status or where they work, learn, live, and travel. Absent policies, though, we still can shape the norms and the institutions that we inhabit. We can build a shared understanding of the need for masking and reinforce social norms that support masking. We know that the ability to mask is much greater in environments where others are masking and where masking is considered socially acceptable. In addition, we in our spaces can provide individual supports to those who are most at risk. We can facilitate access to higher quality masks. We can ensure safer places for them to eat. And there are some things that we should also avoid doing as we think about the conversations that we're going to have around masking in the places that we're at. First, it's really important that we avoid describing legitimate concerns around health and health status as anxiety or emotional responses. I've seen a lot of communication coming from schools and other institutions and public leaders suggesting that those who continue masking are anxious. Masking is a health protection. It's not an emotional response. Second, it's really important for us to do everything we can to avoid stigmatizing mask wearing. One-way masking can visually stigmatize those who are at most risk, and in some settings has the potential to lead to bullying or isolation of people who are already vulnerable. At the same time, or conversely, we want to also avoid shaming or moralizing non-masking. We know from decades in public health that non-participation in or resistance to public health activities often reflects unmet needs. Those who don't mask or who aren't participating are voicing some other unmet need that we may or may not understand. And shaming often reinforces the behavior we're trying to counter rather than changes it. So I want to quickly provide some resources. I'll add them to the kit that may be useful to your conversations and to the work that we're doing. I want to just highlight the first. The Urgency of Equity Toolkit was designed to support schools, families, and communities in making some of these decisions. It doesn't have a guide for conversations yet. I'm hoping that the group will work on that next. And I've also included a couple of other resources and articles that I find particularly useful for schools and communities to use. Before I just close, I want to say that I'm happy to answer questions that you have over email or by phone. Please feel free to reach out to have a follow-up conversation. Thank you.
Thanks so much, Anne. Let's share Anne some love in the chat. Appreciate you being with us today. And not just that, but kind of all the work you've done throughout the pandemic to support schools and making sure that students and educators in our communities are safe. So thank you so much. And now we're gonna have a minute or two for each panelist to introduce themselves before we jump deep into some questions. So we're gonna start with Deborah. The question just to get us kicked off is if you could just take a minute to introduce yourself, share your pronouns, and share a bit about why health equity and or disability justice is important to you. So welcome, Deborah.
Thank you. I'm Deborah Lisi-Baker. I use she, her pronouns, and I'm a member of the Education Justice Coalition and the Vermont Coalition for Disability Rights. And I'm both health equity and disability justice have been important to me in my own life and personal experiences as a person with a disability, but even more from the stories and experiences of people that I've worked with over the last 40 years who've had to deal with major inequities in both healthcare and other aspects of living with a disability. So thank you.
Thanks so much, Deborah. And then we'll pass it to Izzy, if you'd like to share just a brief introduction and kind of why disability and or health equity is important to you, disability justice and health equity.
Hi, I'm Izabelle Shrout. I use all pronouns. I'm a student from Montpelier High School. Health equity is important to me because I have several high-risk members in my household. My mom is immunocompromised, my little sister is asthmatic, and I have a 5-year-old brother. And I think that my family deserves to have a say and to be included in the choices made by our community because they are those being affected.
Thanks so much. And there is, just to share, there is an option I realized to see live transcription that you should have that option if you'd like that. And if you need any support with that or other tech issues, feel free to contact our tech person about that. And I'll pass it to Caroline, who's going to introduce herself as well and share kind of why this issue is important to her.
Yeah, my name is Caroline Dahlstrom. I use she, her pronouns. I am a mom of 3, and my youngest is disabled and medically fragile, high risk to COVID. Done some work in the healthcare advocacy sphere, and now that he is going to school, and this is impacting my older 2 kids' ability to access their education as masks are dropping and other precautions are being dropped in school, and they have had to stay home for many months during this school year. I've started speaking up about equity in the educational sphere as well. I really feel like there's no reason that any child should be denied access to a public education. And if the disabled community is not visible in our schools, there's something wrong, because there are disabled people in every single school community. So yeah, thanks for having me.
Cool, thanks so much for joining us. And Anne, I know you just presented, but I don't know if you want to share any more about why this issue around health equity and disability justice is important to you.
I don't think that I have anything. Well, I guess let me add something personal, which is that, I think many of us, forget sometimes how people who are at high risk are threaded through our lives. They're our friends, our family members, others. And so one thing that I always hope that I can do is, rehumanize the narrative a little bit around that, drawing on my own experiences a little bit.
Cool. Thank you so much. So to start things off, we'll ask some questions directly kind of about masks and this current change. And then we have some broader questions just around COVID and health equity. So to start with you, Deborah, could you share a little more about what disability justice means to you, and really thinking about the disability justice framework and how it can inform our conversation about masks in schools?
I'm sure. Thank you. I guess I want to start by just thanking Anne for starting the presentation with the recognition that public health requires a commitment to justice. You know, Cornel West once said that justice is what love looks like in public, just like tenderness is what love looks like in private. And for me, what that speaks to is, again, that issue of it shouldn't be just personal responsibility, that our public health policies, our education policies, the community priorities that we set should be designed in such a way that they share the commitment and the recognition of the need to make programs and practices inclusive of all people, including students and adults with disabilities and family members with disabilities. So Cornel West also said, he talked once about catastrophes, and he says catastrophes always happen, but when catastrophes hit certain groups of people, certain minority group or marginalized groups harder than they hit others, then that's a recognition that we haven't created just policies, that we really don't understand disability justice or any kind of social and ethnic justice. And so that's really what our conversation tonight and the last 2 years of experience with COVID in this state and in other states highlights. There's been some remarkable, gifted, innovative, and creative actions to make disability justice visible in our schools and communities in response to specific disability needs. And there have been real examples where the issues, everything fell on the families and the individuals with disabilities. And sometimes it's hard to sort of grapple with what justice means and what disability justice means. I'm going to give you a couple not necessarily education related, but very vivid examples from the start of this pandemic. When this pandemic first started, several hospitals and states or communities across the country made policy decisions. They passed policy which said that people with disabilities would not be served before other people or with other people. They would be put at the end of the line because the initial information on the first variant of the pandemic said that people with disabilities were unlikely to survive. So people said, well, let's not waste our resources on those people, and basically denied them access to services. In fact, people who because of disabilities had their own respirators and were using respirators in their individual lives were told that their respirators would have to stay at the hospital and not go home with them. So those are two pretty drastic examples, and it was because we have disability rights laws that federal organizations basically came out with findings that basically said this is unacceptable, that people with disabilities have a right to equally benefit from our health policies and practices in the local community, even during a pandemic. And so they were basically required to end those policies. So I think one of the things that's challenging with disability is that no one disability is the same as somebody else's. So even with things like masking, a disability justice lens on masking has to allow that some people just can't mask, or it's not in their interest to mask. And in others, they really need people to be wearing, around them to be wearing safe, effective masks, and also that they themselves have access to those masks. And in some cases that they have alternatives to face-to-face schooling because their health conditions are such that it's just not safe for them to be in the school setting. And they're entitled under federal 504 and IEP rules to be able to access alternatives and have them written into their 504 IEP plan. And now with people being diagnosed with long COVID, including children, that they have a right to a plan that really addresses their health and education needs during this pandemic. So that includes the children and family members who've been diagnosed, and including educators who've been diagnosed with the broad list of conditions, health conditions that make them more vulnerable to having more severe cases and symptoms with COVID. So the pandemic in many ways takes us into new territory, but it also reminds us of things that people with disabilities and parents and family members have been and allies have been advocating for years, which is really creating the kinds of alternatives that make it really possible without the person or the family having to take all the burden, to have equal access and maybe some alternative access, ways to access inclusive education in communities during some kind of health emergency. And we can only, I think, do some of this because not our disability laws are non-discrimination laws, and some of the needs are not related to discrimination. So it's going to take, I think, working together and using some of the things that we've learned through this pandemic that inform some approaches that have helped create best practices, more true, just, and celebratory approaches to including students with disabilities and recognizing the needs that they have and their families have. In the way we approach whether the state has a mask mandate or a region does or not, that does not take away the right of a child to a full, equal and appropriate benefit to our schools and education systems. And many, there's a lot of talk now that COVID, this pandemic is ending and that it's shifting into a different pattern that makes it easier to manage, but we don't really know that yet. I mean, 3 different variants have come out in this country that had huge impacts on people with disabilities and others. And we don't know whether other variants are going to happen. And we also don't know what future pandemics will happen. So the intention with disability justice and other equity and justice campaigns really call for taking what we've learned from this pandemic and building ongoing policies and practices that are inclusive and creative and equalize opportunity and benefit for Vermonters. I don't want to take too much time. So, but I do.
Oh yeah, go ahead. We can circle back to you too. Go ahead.
The only other thing I wanted to mention is that one sociologist who I read the other day, he said that, before this pandemic showed that we could cut down the deaths from the regular influenza, we all thought it just was something we had to take for granted. We couldn't change that. And the fact of the matter is when we socially isolated because of COVID, it ended up drastically reducing flu deaths. And so this one thing this pandemic has done is reminded us that we need to take responsibility for really changing some of the respiratory threats that people with disabilities and others face, and look at what we can do in terms of some of the best practices that have been identified, like with our heating and systems and air quality and airflow, and really having equal access to effective education, whether you do it online or whether you do it in a school classroom or an outdoor area, taking some of the things we've learned to move forward into the future. Thank you.
Cool. Thanks so much, Deborah, for sharing that broad perspective and those stories and those quotes. Really powerful stuff. I'm going to pass it on to Izzy from Montpelier High School. Is going to share a bit of a student perspective. And Izzy, if you could share a little bit about what the ending of the mask guidance has had on you and or other students. Thank you. Oh, and you might be frozen. Izzy, if your connection's bad, you could try turning off your video and talking that way. That may help us hear you a little bit clearer.
Sorry, there's a lot of people on the Wi-Fi right now, and it's really bogging down the internet. So how it's really affected students, it's really tense walking down the hallways and seeing so many different opinions of, people choosing to wear masks, people choosing to not wear masks, and you can see the people who are scared of, for the future. And I've come to respect everyone's decision, but it pushes past an issue of respect when it turns to people being aggressive about their decisions. I'll be walking down the hallway and a group of unmasked people will laugh at me and cough on me simply because I am choosing to mask or because I choose to be safe. And I feel like that's where it becomes an unsafe issue because I no longer feel safe coming to school. I no longer feel safe sitting in science class when the person sitting next to me is unmasked and I know they just had COVID and they didn't do the 5-day long quarantine that is suggested. And they just came back after 3 days of being diagnosed. And I should not have to worry about my safety when I should be learning. And I feel like educators, legislation, I feel like they need to take students and families into account for their for their future decisions and any decisions. I feel like our voices need to be heard and are concerned because they made generalized statements about us saying, "Oh, but the students need to go back to normal. It's affecting mental health," when we were not consulted if we wanted to go back to normal or if it was affecting our mental health. And I'm so much more anxious all the time coming to school because my friend just got COVID a few days ago. What if she gave it to me? What if I gave it to my family? And it's a constant internal struggle. And there's many days where I've contemplated, should I even go to school today? Because I don't know if I'm going to be safe today. And it's a really tense and scary situation. But I'm really hopeful that conversations like these and meetings and steps forward that can help us feel safe in our schools, because I shouldn't have to feel scared every day.
Thanks so much, Izzy, for being here and sharing your perspective and lifting up student voices for yourself and other students that were organized at Montpelier High School. And yeah, just want to name and lift up the fact that students were not consulted on this decision and a lot of other decisions, and that as we think about moving forward as a community to continue to center that. And also want to lift up, which is a question we'll come back to later, is kind of this idea around like, if it ends up being that the only students that are masking are the ones that are either medically vulnerable or have medically vulnerable family, what does that mean to be putting that burden on those students? So just kind of like lifting that up for us to think about. But thank you so much for being here and for sharing. And I'll pass it on to Caroline. From a parent perspective, what impact has the ending of the mask guidance had on parents, and particularly parents with immunocompromised kids or family members? So thank you so much for sharing your perspective and experience.
Yeah, it has been a jarring experience. I mean, this whole pandemic has been for all parents. I'll acknowledge that right off the bat. No matter what health conditions your kids or yourself have, it's been tough. But for this most recent change, it felt like it came really fast with no heads up, not great communication, and really left us scrambling more than any other change that has happened this pandemic. I have said over and over how lucky I feel to be in Vermont, having a child like I do, who is medically fragile. We lived in Arkansas for 5 years, and I still have a lot of friends there. A lot of them have pulled their kids fully out of school last year. I don't know how, our family got lucky to get offered a job in Vermont, shortly before we had my son, and be out of that environment and be in a place that we were more taken care of than in a lot of other states. And then it felt like overnight that all fell away. And it has been really hard to come to terms with. People who I have felt really supported by this whole pandemic, and were, even if they had not a single family member who was high risk, had no experience with it, they supported us. They were always cautious around us, always masked even when they weren't around us. You know, they understood the importance for the community of masking, and the first day they could send their kids to school without masks, they did. And it wasn't even like, oh, you know, if you want to take it off, you can. It was like, yes, masks are done. Didn't send them to school with a single mask in their backpack. It was like, whoa, I really felt like I got the wind knocked out of me. My daughter, my middle child, is in kindergarten, and she was the only child in her class wearing a mask. These are a lot of families I know and like and respect and have felt supported by. I had a conversation with her teacher halfway through the school day because my daughter took off her mask, and I was like, I'm going to need to come get her then. Like this, you know, we've set this guideline for our family that this is what needs to happen. And I don't feel safe with her being there without a mask. And her teacher was in tears on the phone with me. You know, we have felt extraordinarily lucky to have amazing teachers for both of my older kids, and it is the only way we've survived this school year. Last school year, thankfully, Vermont, stayed in a pretty good place, and I had no idea how it was going to go going back to school after being home that second half of the 2020 school year, but last year went really well. We had not a single exposure. We felt really supported by the school system, by our community. I felt so grateful knowing other families who have health conditions, like my son, who were struggling to access healthcare, who, you know, their hospitals were filling up. They were in a really scary, really dangerous place. And I felt so grateful that we never got there, while feeling just heartbroken for all of these families who had no choice. And, you know, this is the cards that they were dealt. And it was a weird reality to live, talking to these families who were struggling so much more than we were, wanting to support them, and really having next to nothing I could do for them. I would try and coordinate and get them contacts at Boston Children's Hospital where we receive care, and, try and see like if they were really struggling to access care, try and help them that way. But at the end of the day, there was very little I could actually do to help them other than to just be a supportive ear, to listen. And then this school year, everything changed for us. We thought this would be an easier school year than last year. I think everybody agreed. And within a week of school starting, our school system had multiple cases. Our child was exposed, our oldest child, and we realized that this was not going to go great. Both of my older kids were home on and off in the fall. My oldest was home for like a month straight, and then different weeks here and there. And then after winter break there, Christmas break, neither of my older two kids went back to school in person. We just saw cases skyrocketing and knew that there was no way that they wouldn't be exposed at school, and that it was pretty likely they could bring it home themselves with how contagious this latest variant is. So we kept them home for I think 7 weeks, and we were fully in charge of making that plan. And, while our school system was supportive of us keeping them home, the request, like the acknowledging that they needed to be home, requesting that they stay home, putting together that plan, working with the teachers, that all came from me. And I keep saying, both in the educational world and in the healthcare world, like, I can do that. I have the bandwidth to do that. I have the voice to do that. I have the privilege to do that in so many ways that I can be really loud and I can advocate really hard, and so many people don't. And what happens to the people who don't have the capability to do what I have done? They fall through the cracks. There's no way that they don't, because if I weren't working this hard, my kids would fall through the cracks and wouldn't get what they needed. Our kids' teachers rallied around us, put forth a really superhuman effort. My fourth grader's teacher taught my son virtually while teaching in person, and would, you know, Zoom him into class, and maintained a social connection, and had a lunch bunch that he got to join on the computer, and kids would carry him around on her Chromebook when they went to specials, and would argue over, you know, who got to carry him. And it ended up being as good of an experience as it could possibly be, although it was still really heartbreaking to see my kids alone and isolated, and the weight of knowing why they needed to be home. They knew, my kindergartner can't fully wrap her head around it, but my fourth grader absolutely knows why. They have seen their brother in the ICU a dozen times. They have seen him leave our house in an ambulance. They have walked through the ICU at Boston Children's Hospital many times and seen the kids in there. And that's a really hard environment to be in. There's no way for them to not know what this virus, what other viruses have done to their brother, and know the weight of needing to protect him. And they do it, you know, not always without complaint, but they always make that choice. We actually gave them the choice going back to school in January of if they didn't feel like, if they felt like staying home was too hard, that Wilder and I, my youngest, we would move out. We would find another place to go. And so they could go back to school and we wouldn't risk exposing him. And my oldest sat down to the conversation, was like, you're going to tell me we can't go back to school. All I want to do is go back to school. I hate this. And as soon as we presented him with the options, instantaneously, he said, nope, we're doing homeschool. You're staying here. So just, yeah, that sacrifice that they have made, that families make to protect our high risk loved ones, is above and beyond. I don't think it's a bad thing. I think my children have grown to be amazing human beings and have amazing compassion, but that weight shouldn't be just on the family members of these individuals. It should be supported by the community, like it was earlier on in this pandemic. We did not feel like it was all on our shoulders to keep Wilder alive, and now we truly do, and we can't do it alone. There's no way that we can. He got really sick. I thought it was COVID. He got really sick last New Year's and was in the hospital, and was requiring a lot of oxygen. And I know a nurse who was in LA who said, oh my gosh, if he were here right now, we literally could not provide that oxygen for him. That's when they were literally running out of oxygen. And hearing things like that, it's like, I cannot do this alone. Like, I need other people's help. If I showed up to the hospital and they literally didn't have the tools needed to keep him alive, what would I do? We've put forth together contingency plans with his medical team of using our own ventilator at home that he uses at night for BiPAP, bringing that to the hospital in case they were to run short on ventilators, all of these things. But I always felt like through all of that, that school would be a given, that school would be the safe place, and not necessarily fully safe, but that school would always be an option for my kids. And this year, it just has not been. And the only reason that it has been is because of the work that I've put in to find options for them, and their teachers have put in to try and make this work. And with this latest, I don't even want to call it revising of guidance, just taking away guidance with when positive cases can come back to school, it's looking like my kids are going to be excluded from school again, because I can't run the risk of sending them to school and having a kid sit next to them who is still COVID positive and contagious and not wearing a mask. That is too high of a risk. Our medical team has said that's too high of a risk. And I really identify with saying, like, you know, this, how we talk about people who are still wearing masks and taking precautions as just being anxious or emotional. This is something I've gotten quite a lot through my journey with my son. When I first brought him back into the hospital, he had a long NICU stay because he was premature, and then he started having health issues immediately upon bringing him home, and I brought him back in, and they told me it was my PTSD and he was fine. And it wasn't until I had to give him CPR at home that they listened to me. So this is commonly done in many different, you know, like you're just being emotional and you're overreacting. And no, in fact, like I'm right. And in this case, I'm actually just following doctors' advice for what to do with my kids, and to come with a doctor's letter saying my children should not be in school and being told that doesn't matter. The state of Vermont has made it so that remote schooling is not allowed. Too bad, so sad. You know, if the teachers want to go above and beyond to provide them this opportunity, we will absolutely let them, but your children will be marked absent every day. You know, technically they will not be in school. That was really hard to hear. You know, my youngest, because he has an IEP, he was able to get his services remotely, and my older two were not. And that just, yeah. Inclusion means inclusion of everybody, of people with disabilities, of people who are high risk, of their family members, of everybody, of a child who just does not feel comfortable being in school without a mask, or does not feel comfortable because they know that there are many positive cases within their classroom. I mean, it's, yeah, inclusion is inclusion, period, end of story. And if we can't see that, like, I don't know what we're doing. So I'm going to keep speaking up because I know that I have the ability to do that, but like, gosh, we have to get our public officials on board. We have to get our school systems on board. We have to start proactively finding out how we can be inclusive of these children and keep them safe in school and make them feel welcome in school every day. Every child should walk into school and see themselves in school. Every child should walk into school and know that they belong. That's just a non-negotiable for me. So, yeah.
Thanks so much, Caroline, for sharing that really powerful testimonial. And I think it just brought up a lot of things around like this value. We have a coalition of like, we don't leave anyone behind. And so I think that's what's happening right now to you and your family and other folks. And I think that some points you brought up, which I think are really useful, just thinking about this kind of narrative and tension between system and public health being like, we're all responsible for each other versus when it falls on individuals, and just the experiences you've had where you felt like the system was there to support you and other states it wasn't, and where it's not. And just this idea that's very powerful of like, I think it's falling on, you know, parents that happen to have a loud voice and resources, or teachers that are getting really burnt out, right? Like there is no online option. So your teachers are having to go above and beyond. Can they continue to do that for years on end, you know? And so we're asking too much of teachers and parents, and we're asking things that oftentimes parents can't do. So thank you for naming all that and kind of like, recognizing, kind of where people are falling through the cracks. I'm going to pass the question on now to Anne. I don't know if you have, there were quite a few questions that came in, and around the event when people were signing up for Zoom, specifically around how do we advise that students with disabilities protect themselves? How can I help protect my students from teachers asking, how can I protect myself? So I'm just curious if you have any thoughts around that, or like how to help parents make decisions about whether or not their kids should wear a mask. So if you have any thoughts around that.
So I guess a couple of thoughts, and thanks to the others for speaking so powerfully to these issues. I think that, as recognizing that we're in the moment that we're in, I think, as an immediate action, we want to do everything we can to support those who are at higher risk, and that means ensuring that they have access to, the highest quality mask possible, and that we make their environments as safe as possible. And I understand, that having heard from teachers, across the state, that many feel really constrained in their ability to do that. But I also think it's important that we work to change sort of the social norms around this, that we sort of cultivate solidarity and empathy, and we help others to understand, that we need a collective approach to this, that, high-risk people are part of our communities, that our lives rely on them as much as they rely on us, and that goes beyond. That's not just an evidence-based intervention, as we often said, but it really is. I think there's that we need to bring a different ethos to this. So that's perhaps not quite the question that parents had. And I also want to just finish by saying is, I know that there are other questions that if you're on this and you have specific questions, kind of technical questions, please feel free to reach out offline, and I'm happy to talk with you by email or by phone after this.
Cool, thanks so much, Anne. So now we have a question thinking about, I don't know if they have a lot of rights right now, but if anyone could speak, and Deborah might have done a little research on this, is what protections and rights do students with high health risks have? And then really thinking about dreaming into where we want to go, what protections do they need or do we hope they'll have in the future? And Deborah, I don't know if you want to start that off and kick it off to other folks as well.
Could you say the first part of the question again?
Yep. Yeah, what protections and rights do students with high health risks have? And what protections do they need?
I think that that they don't have enough protections, but it's partly because again, we haven't framed our social responsibilities and our public health responsibilities to be inclusive. And so every time an administrator meets a child or a family member with significant health risks, they're not prepared to really have a creative dialogue and figure out solutions. I was really shocked to have a conversation today with somebody who said that she just talked to a group of parents, and they're basically saying that many of the educators they worked with don't have a clear idea of how to make an effective IEP or 504 plan. And health issues are, I've hardly left the house for 2 years, and I don't even have as significant health risks as other people. And so I think part of what we need is the kind of dialogue we're having now, but we're literally creating prompts for a more effective plan, both for particular students, but for schools to be able, or other social organizations, to be planning more effective strategies without it being so difficult for the students or the families and for their allies. So, there was a comment in the chat earlier regarding my comments, saying that it's good that people remember that not all students with disabilities can wear masks, but we need to make sure that people around them wear masks. And I had been thinking about that when I was preparing my notes, that for some communities and some schools and some teachers, they've actually intentionally had small clusters where kids wore masks. And it wasn't something that was held up as a negative thing. It was a shared decision to be there together and to make it a safe space with a smaller group, not all segregated people with students with disabilities, but a segregated group of their, a non-segregated group of their peers, all who chose to use masks to make it safer for the student or the family members they go home to. And so I guess the only other thing I could say is that what I found doing disability advocacy over the last 40 more years is we need the stories of people who have high health risks, so we can use those to inform improvements in public health policy and legislation to more effectively think ahead and figure out how to incorporate the stories and experiences of those people into the policy and social solutions that we're implementing. And this is a really good time to be doing it because of the awareness that COVID has given us, and the extra funding has come in to look at creating some solutions. But we'll do a much better job if the stories of the individuals and family members are driving the design.
Cool. Thanks so much, Deborah. And a follow-up question, I'd love to hear maybe kind of related to that from Izzy and Caroline. If you could design policies that would, protect, and I recognize it's not just students that have high health risks, but students that are living with people with high health risks, right? Like obviously we could bring back a mask mandate, but beyond that, what suggestions would you give kind of at a school policy level that you wish was there, so it wasn't all kind of like individual teachers having to go above and beyond? So I'd love to hear from Izzy and Caroline, either one of you or both on that one. Izzy, do you want to start out just sharing what kind of you would hope the school would provide supports to you or other students?
Yeah, absolutely. I think my biggest issue beyond, obviously safety and, stricter safety precautions, because when the policies were up, they were very leniently enforced. I think my other issue is just having a say in decisions. I feel like, students, families, community members need to have a say in these decisions that are made, and we need to have discussions in schools about these decisions during our restorative practices that Montpelier is trying to bring back. I know that the day Montpelier's policies went into effect, March 2nd, we had a discussion that morning when it was already into effect about how everyone felt about it. One damage was already done. And so at that point, it was just to, make it seem like the school tried to do something about it. But I think those discussions need to be more in depth and not short 20-minute discussions. There's a series of discussions that need to happen before these things go into effect. And we don't just need to say what we want. We want our says to be included in those decisions. We want to be more than just acknowledged. We want to be taken seriously. We want to be listened to, and we want our words. We want to be heard. We want what we say to, go into effect, because we're ultimately the students. We're the ones that go to school. So we should say what happens when we go to school. And families, they're what has to deal with what happens when we go home. So they should say what happens at school for when students come home. And I think schools need to be more on top of having these discussions, having these panels, like meetings, and just more say to the people and not to the higher power, I think.
Cool. Thanks so much, Izzy, again, for speaking on why student voice is so important and what that would look like and how we could use restorative justice and other forums to really have those conversations. So love to hear from Caroline, and then Anne, really thinking from that school policy, IEP 504 perspective, kind of like what, Caroline, would you imagine would be there to support parents like yourself?
Yeah, I mean, same thing. We should be listening to the students primarily, and when they're really young, to the parents, and even when they're older, to the parents, and getting that input before any big change is made that really affects them. One thing that I meant to bring up before, and I don't think is happening in schools around here, at least I haven't heard about it, but I know in a lot of districts they actually have a rule that says students cannot wear a mask if they can't remove it themselves, every time for a safety liability reason. Well, a lot of students with disabilities who may be higher risk for COVID may not be able to take off their masks themselves. So now they are prevented from being able to wear a mask in school. And when all the others around them are not wearing a mask, that makes school an unsafe place for them. I know of one family whose child is now excluded from school because he can't remove his mask himself, and they've dropped the mask mandate. Things like that, take that into consideration. Think about how this is going to affect everybody, and talk about it. That's what I've asked of our district. Is I felt completely invisible. My family felt completely invisible when they announced the dropping of masks. It was just, if you don't feel comfortable, you can still wear one and we'll support you. But there was no talk about why somebody would still need to, not just and there shouldn't be, if you just want to wear a mask, cool, great. Keep wearing a mask, and nobody should, say anything negative about that at all. I think that's an amazing thing to be doing, just to be a community member who cares about other people. But there needs to be some discussion of this is still a big deal, and it's still a necessity for a lot of people, and they're doing this to take care of their health. You know, we put a mask on my son as advised by his doctors prior to COVID, and without fail, everybody who saw him in a mask was like, you are such a great parent. Like, oh my gosh. And you work with him to keep it on. And that's so amazing that you would do that for his health. And it was like the most glowing positive comments. And now we go out in masks and we get negative comments. And it's like, what happened? It's the same mask on my face, guys. So, I mean, you need to make these individuals and these families feel visible and have an input and feel like they have a say in these things. And, you know, yeah, we're not going to put masks back on everybody's faces. Like, I have accepted that, as much as I, you know, may not want to, but what can you do then? Okay, can we bring back a remote option? What can we do? Can we put clusters? I love that idea of student clusters where all those kids have chosen to mask. You know, my kindergartners asked for that. Like, I just want one friend with a mask. Can you find me one friend with a mask in school, Mom? And that breaks my heart. You know, I can't, because there's not one in her class. And, you know, that's not an option for us right now, really. But that would be amazing. Send out a poll to families. Who is still going to mask? Who feels that this is important for their family? And, you know, form student groups because of, you know, around that, where students can feel safe and supported. Things like that, I think, are completely doable and would make a huge difference in how supported families with disabilities felt.
Thanks so much. And if you wanted to add a quick thing, then we're going to pass it off to Angela and Roderick for a brief presentation.
I just wanted to echo that and move beyond a little bit what I would say to individual families and bring a policy perspective to that. And echoing what Caroline just said, you know, if we want to advance equity, we really need to move beyond empty rhetoric on protecting the vulnerable and look at like the specifics of those lives and the, you know, and the places that they inhabit, and then design our policies and our actions around them. If we're not going to have mitigated schools, then we need to think about what other accommodations need to be in place. And that might be remote options. If we're not going to have mitigated workplaces, that might also need to be remote options. We need a lot of specificity if we're going to even, you know, move in the direction of an equitable response at that moment. Thank you.
Thanks so much, Anne, and for closing us out and kind of naming that it's like we have to move beyond rhetoric, right? This is a conversation, but the whole goal of it is to move towards action. So appreciate you panelists. Share a little love in the chat. Thank you so much for the really powerful discussion, and loved hearing kind of everyone's perspectives from different levels. I'm going to invite our wonderful volunteers, Angela and Roderick, up to share a little bit about some ideas we have, and you're welcome to contact me and we can add to these about how to have some of these conversations at your schools.
Thank you, Alyssa. I wonder if Roderick, or if we should share our screen while we're, since these aren't on it's not on the slide deck, right? So I could share my screen if that helps, so that we can see what we're talking about.
Yeah, feel free to do that, yeah.
While I'm doing that, Roderick, do you want to get us started?
Sure. Hello, everybody. My name's Roderick. I'm he, him, and I'm one of the newest organizers on the Education and Justice Coalition. And it's great to be a part of this conversation. And thank you guys so much for all your feedback and input and adding to the conversation. And it feels good as someone who's works in the school system up in Orleans County to hear that some of these messages are being, are shared throughout the state. And we were all caught off guard by the, changing of the mandates and going from, from mask required to mask optional. And I think one thing that I would like to share is something that my principal presented during our equity team's conversation last week, as we were all grappling with how are we going to explain this to kids and to parents. And, one thing that she said, and I definitely appreciated and have reiterated it numerous times is, maybe we shouldn't think of this as a mask optional environment, and maybe we should think of it as a mask friendly environment. So how do we create a mask friendly environment inside of our schools, so that everyone understands that, it's okay if we want to wear a mask, and it's still want to wear a mask, and it's actually encouraged. And I can pass it over to you, Angela. And looking at the time too, we might just want to show them where it's stored at and go to small group discussions.
Yes, I hear that. And I'll just introduce myself as well. I guess I skipped that part real quickly. My name is Angela Arsenault, and also volunteer with the EDGE Coalition, and school board member in school board chair in Champlain Valley School District, so Caroline's district. And I'm very grateful to Caroline for taking the time both to be here today and also at least an hour and a half, I think, on the phone with me last Monday to help me understand what would feel like support, what would support look like from our district for your family and others like your family. And so, as Roderick said, this document exists, and as Alyssa has pointed out, and actually, if you can all see my plethora of tabs, sorry if that stresses anyone out. I got a lot of tabs open, didn't plan well for this, but this document came together through both, some anecdotal thinking and sharing of stories, and some research. And one of the first, as Roderick said, was this contribution, this idea of a mask-friendly school, which happy to say our district has moved to that language. So I have you to thank for that, Roderick. We have messaging tips for admin and teachers. And then, and actually a lot of these points have been brought up today or this evening. And then we also offer messaging tips regarding the fact that the pandemic is not over yet. And, sharing some, of course, with the dropping of guidance from the AOE does not mean that, to my mind, that districts can't still offer guidance, or in the form of pointing parents, caregivers, community members to other resources. So we have a few of those suggestions here, such as the newly released or fairly new CDC COVID-19 community levels, to make educated and informed decisions about your own community by county, offering data to your students and families, so that now that we talk about personal responsibility, we all want to make informed choices, and then also getting into the most recent guidance from the Vermont Department of Health, which just changed today. So that was like a quick, here's where it all is, here's what it is. But Roderick, if you want to pick up anything that I didn't pick up that you want to highlight, please do.
Well, the one thing that I would add is what actually Anne brought up during her presentation was the urgency of equity framework and slideshow. If you haven't had a chance to take some time with that, the urgency, that one right there, you should definitely spend some time with it, because it's giving you up to the minute and date health information. And yes, a lot of things have been politicized in this conversation. And yes, I mean, and I've heard a lot of the conversations in the school board meetings where people were literally complaining about their personal comfort over someone's public health. So it's definitely for me, we have to stay true to the facts and definitely keep track of the CDC and keep track of your community, and don't do anything you're not comfortable doing.
Cool. Thanks so much, Roderick and Angela. Any last words, or want me to move into small groups?
I was going to add that we love feedback and input versus feedback on this. If folks if something doesn't feel quite right, or if there's more that you think it would be helpful to say about anything that's raised or anything that hasn't been raised, it's really a dynamic document. So always welcoming suggestions.
Cool. On that note, I made it so that everyone can comment. So if folks want to comment, and I can give you access later to add to that. But if other folks from the community want to comment or ask questions, we can keep it kind of a live document. So we don't have a ton of time, but we'd love to do small groups for about 10 minutes here. So folks, because there's a lot of really great information. And Angela, I don't know if you can unshare your screen. There was a lot of really great information that was shared during the amazing panel. And so I'm going to pop in here some prompts for small group. It's in the first slide here. And I'll also put those questions in. So it's just introducing yourself, sharing what brought you here today, any outstanding questions you have about the mask mandate, and what other issues around COVID equity came up for you. So I'll put those in the chat, and they're also on that PowerPoint. And I'm going to pass it off to our lovely tech host. Folks are going to go into groups of, I think it's 3 to 4 people for about 10 minutes, and we'll come back to join for a closing. Hey everyone, welcome back. I know that probably wasn't enough time to chat, but it was great to hear from folks. As we're closing out, I see Deborah sharing her email in the chat. If anyone else wants to share their email in the chat for folks maybe you spoke with to continue those connections. And I'm going to share, a feedback survey here. But we love to hear people's feedback. There's also an opportunity to sign up for volunteer. I don't know if, because there's a lot of people that volunteered to help organize this event that maybe were not panelists. So do you all want to give some kind of reaction so we can thank all the people that volunteered? Maybe like a thumbs up or a hand raise or something. But thank you to all the education organizing committee members for volunteering. This is a feedback survey. We really appreciate getting feedback from folks. And yeah, the last thing I'll announce that we'll be emailing out to people is we have a series of workshops coming up at a conference put on, the Education Justice Coalition does, by the Human Rights Commission, that's happening the last week of March and the first week of April. We really hope that you all will join us for some of those. And so when I'm sending our follow-up email, I hope to include that. And as we're leaving, if folks want to leave a thought or question in the chat, just something you're leaving with, and I'll share some of those out as we're closing out here. But huge thank you to the panelists, and appreciate everyone coming out tonight. And thank you to the tech host, Alicia, for your support and smooth breakout rooms. So thanks again, everyone. Yeah, and we'll try to email the links that I see the question from Anne. Thanks for putting this together. Thank you. I love the Education Justice Coalition events. Thank you to all who spoke. Incredibly helpful. Thank you to the panelists and the organizers. Appreciate the personal stories. Lots of love to you all. Some recommendations on safeties to implement for higher risk children who attend. All right, so we'll try to put together some resources after this event for folks, and we'll send those out in the next couple of days. And for anyone that helps organize or panelists, we can hang out for a little bit afterwards. I'm happy to hang out and chat for a little bit.